Shoulder to shoulder, a phrase that makes sense for a local community organization. But you may wonder, how could it ever refer to the relationship between people in Cincinnati, Ohio, and one of the poorest regions in Honduras? Indeed, that is what happened. The name Shoulder to Shoulder describes a very unique partnership that developed in 1991. It continues to grow in strength and impact.
I want to invite you to hear an exciting story. My name is Dr. Jeff Heck, Director of Shoulder to Shoulder.
Shoulder to Shoulder, in conjunction with the University of Cincinnati Department of Family Medicine, has been working in Honduras, Central America since 1991. This story is about U.S. and Honduran volunteers working shoulder to shoulder in Santa Lucia and neighboring villages. When Dr. Heck took his first medical brigades to Santa Lucia, they set up a temporary clinic and pharmacy in the local school. The need was so great that they would see up to 200 patients in a day. Some walked for 8 hours from remote villages accessible only by footpaths. After a needs assessment conducted with the Community Health Board, a clinic was constructed and completed in 1995. The planning and construction was truly a partnership of people working side by side. When the clinic was completed, it was staffed by 2 Honduran doctors who live at the clinic and tend to the daily medical needs of the 15,000 people who live in the area. With exam rooms and additional diagnostic equipment, the treatment capabilities dramatically increase the quality of care. More community leaders emerge who are committed to serving the poor of their country. Medical brigades from the U.S. learn how to practice primary care among the poor while treating them with dignity. Shoulder to Shoulder became a model partnership between a U.S. community and a Honduran community. It was also clear that the total community health required more than the treatment of disease. Prevention and education were also required to break the vicious cycles of poverty. So, a dental clinic was added with 5 dental chairs. The Honduran doctors and medical assistants are trained to do both preventive and emergency care. The preventive care now includes fluoride treatments and dental sealants. A water project has worked to improve the quality of the water as it comes through the town. Currently, there's a pilot project testing the viability of low-cost gravity filters that will provide clean water at each home. This filter has worked remarkably well at the clinic. Eye care has also been a recent addition. Through advanced technology, it is possible for the clinic staff to test the eyesight of patients and fit them with the appropriate glasses. These have been great advances for the people, but 2 problems will keep the people in poverty and chronically sick if they are not solved. The first is a problem of malnutrition. A study done in the area of Santa Lucia showed that 64% of a random sample of children 5 and under had evidence of malnutrition. And children who are malnourished don't do well at school if they attend at all. In 2001, Shoulder to Shoulder began a school-based nutrition program for children, and the results have been remarkable. Now, every school day, over 800 children from 8 schools receive a hot meal at school, and it's not a giveaway. A community must build their own outdoor kitchen, pick up their food in Santa Lucia, and the mothers must take their turn at cooking. The eagerness of the children at mealtime tells you that they are hungry, but many more benefits are coming as a result. Listen to what teachers and parents have to say.
From a teacher, Petrona Vasquez, these are her comments. Before, 8 mothers did not participate. Now, all mothers are helping twice a month and all 190 children are eating. The children are more active and alert. They participate in class and play more at recess. My job is easier. Attendance is up tremendously since the nutrition program began. The mothers are better parents now. They are more responsible and are proud to work hard for their children. The parents have a sense of ownership in this program. They do not want to lose it. Thank you for helping us by helping our children.
Jose Nolasco, a principal from the village, and these are his words. The people from the village built the town's first kindergarten through the hope generated by the feeding program. For the boys, we now have a soccer team that competes with other villages. The boys from San Francisco are stronger because of the food program.
Rosa Martinez, a mother who cooks at the school, has this to say. I arrive at 6 a.m. along with 5 other mothers to begin preparing the food to have it ready for lunch at 11 a.m. When asked what impact the program has had on her children, she replied, "The children, they now look so pretty. They don't have to walk a lot to get food. They can take time for rest and homework. Now we have less problems with our children's health."
For only $60 a year, we are able to feed a child and provide for their medical and dental care. Other villages would like our help, and our hope is to reach 4,000 children. With the schools becoming more important to the communities, a project was recently funded to help break the cycle of poverty for children in the feeding program. Shoulder to Shoulder hosted a training seminar for 35 area school teachers. The emphasis was on the development of a practical life skills curriculum that would encourage girls to stay in school and dream of greater possibilities for themselves and their families. With the momentum and hope generated by the nutrition program, we look forward to the results from this additional school-based initiative.
We have been humbled by the success of Shoulder to Shoulder. It has become a model of health care for the poor. We also have enjoyed the strong support of the former First Lady of Honduras and Minister of Health, who have visited Santa Lucia on several occasions. Our vision for the future remains anchored by our foundational principles. Shoulder to Shoulder is committed to investing all of its available resources towards accomplishing its mission. To date, all of its U.S. participants are volunteers, and none of our budget is used for administrative costs in the U.S. But most importantly, as long as there are compassionate people in the U.S. willing to come alongside of Hondurans committed to making a better life for their people, there will be a Shoulder to Shoulder. The result of this partnership has been hope through changed lives, and we appreciate any part that you are able to play